Agreement with Pfizer for 20 million dual-shot COVID-19 vaccines. Reuters has been reporting that it will boost plans to start mass vaccinations in this country from April. The government approved 31 million shots from Johnson & Johnson. That was announced earlier. Last week, the president said that with the deals in the pipeline, South Africa would have enough to vaccinate around 40 million people. That is out of a total population of 60 million. Of course, there have been questions about the pace of the vaccination program and when these shots will actually arrive. Given that South Africa is also likely to be hit by a third wave of infections, the DA now says it will approach the South African Human Rights Commission to probe government's slow COVID-19 vaccine rollout strategy. To discuss, we're joined by the DA Shadow Minister of Health, Siviwe Gwarube. Thank you for being with us, Shadow Minister. What are you planning to do, or what have you done?
Good evening, Francis, and good evening to your viewers. Our view is that while there have been global factors which have really contributed to South Africa's response to the COVID-19 crisis, the reality is that there's also been a series of actions and inactions that government has not taken when it comes to the rollout of this vaccine. In particular, if we look at the fact that South Africa was only focusing on the COVAX facility for the longest time when it came to acquisitioning of the vaccines, and now we look at the fact that we've only vaccinated just over 269,000 healthcare workers. Now, this is a fraction of what was the target of vaccinating 1.2 healthcare workers. And it's obviously a drop in the ocean against the target of vaccinating 40 million South Africans by the year end. Our view is that
however, though, is your timing not a bit off now? Because there have been concerns about the slow vaccine rollout, but now we're hearing about the deals, 20 million vaccines from Pfizer, plus the 31 million from Johnson & Johnson. So it looks like we're getting there now.
Look, absolutely. I mean, like the announcements have been are welcome, but Francis, you'll remember that every single time in the past couple of months, we have been made to celebrate milestones of whether doses have been secured, now a contract has been signed. Ultimately, we are way behind than other countries who are of the same socioeconomic status as South Africa. The countries like Zimbabwe, right next door to us, have started vaccinating people in their hundreds of thousands. The reality is that government has failed spectacularly to roll out a vaccine rollout, to roll out vaccines to the most vulnerable and to our healthcare workers. The Human Rights Commission is best placed to look at that and to look at whether or not government has failed to uphold Section 27 of the Constitution.
Well, the fact is you don't really know, right? Because there are non-disclosure agreements. The Health Department has been hinting that it has been in talks with various manufacturers. So with those non-disclosure agreements, we don't actually know what government has been or hasn't been doing behind the scenes, right?
So, look, ultimately, I am aware of the non-disclosures, and these are sometimes are prerequisites for manufacturers dealing with governments in its entirety. But first of all, we should not be relying on government on hinting on whether or not when we're getting vaccines, when they're going to be rolled out. The reality is that the proof is in the pudding. And what we have now is less than 270,000 healthcare workers who have not been vaccinated, even in the trial phase of the vaccine rollout. And that, for me, represents a spectacular failure that needs to be looked at and investigated. And the Human Rights Commission is best placed to make those findings, and the Parliament is best placed to hold government to account to that, which is
But, okay, there have been concerns, but if the vaccines do land in April and the mass vaccination program starts, aren't you wasting the time of the Human Rights Commission? And what difference will it actually make? What's it going to do to government? And what could it do that could actually speed up this process if those vaccines are now in the pipeline and they're due for April?
Look, the reality is that in the past couple of months, government has put down timelines after timelines, and they've yet to meet any of those deadlines. They've yet to meet any of the commitments that they've made. And so, yes, while we accept that they've set a target of vaccinating 50,000 people per day once the max vaccination rollout begins, the reality is that we have no proof of that being able to happen. In the past 4 days alone, we have not vaccinated a single South African. A single dose has not been administered in the past 4 days alone. And so now we are meant to expect that somehow the infrastructure will catch up and will be able to roll out 50,000 a day. The reality is that these Chapter 9 institutions are there for a reason. The Constitution makes provision for it, and therefore they must be best placed to be able to investigate government performance.
But again, I'm harping on this point, but what about the timing? What about the timing again? So there have been concerns, and you're coming in at the tail end of that, laying a complaint. What if these vaccines do land in April? Shouldn't you wait until then and see what the picture is, say, at the end of April?
No, this is what I'm trying to explain to you, Francis, that what about the timeline? The timeline, firstly, is the fact that government has been delayed until now. They have not met any of their targets until now. So what reason or on what basis can we trust that 50,000 people will be vaccinated? On what basis are we to trust that these vaccines will arrive and, in fact, mass vaccination will begin? The government has not covered itself in glory in this instance. And secondly, on the issue of your question, what difference is it going to make? What I'm saying to you is government needs to be held accountable. We can't simply fold our hands and say, well, we'll wait until we can only hope and pray that really that vaccines are delivered when they say they are. The reality is that we've got institutions, we've got mechanisms that are provided for by the Constitution to hold government to account, and we must do so. And we have not come at the tail end of this process. We have been calling for government to essentially ramp up the vaccination rollout process continuously. We've done so in Parliament. We went to the courts to ask for a rollout plan from government. Continuously, we have done this. And that's why now we are saying, well, there's been a failure. There's been a failure to uphold human rights. And that's why we're asking the Human Rights Commission to come in.
All right, thank you very much. That's the DA Shadow Minister of Health, Siviwe Gwarube, and we'll follow that complaint.